I do integrative mental health, and what that means is I combine traditional therapies with other integrative approaches on how to move your body so that you can help to release trauma. So we work on the attachment issues and the chronic and traumatic stress, along with where it gets stored in your body and how to release it. And then there are many different modalities of treatment that we can use, from exercise to yoga to qigong to Krav Maga to meditation and mindfulness and drumming and music and movement and acupuncture. We work with nutrition, breath work. So I think, we're moving towards a different model in the mental health world, where it's not just about understanding what you think, what you believe, and how you feel, but how you affect those thoughts and beliefs and feelings affect your relationships to everyone and everything. And so plant medicine is a very important part of helping the body to self-regulate and self-heal, and we can talk about that a little bit more. But also, there's different types of work, and they call it somatic work, where you actually use how the body processes information and how you release that. I use some protocols, some modalities of treatment called EMDR, which is eye movement desensitization reprocessing, which that helps you to target the negative beliefs and release them and be able to install in the new beliefs. And you do that by bilaterally stimulating the brain, whether it's through sound, touch, or eye movement. And there's a very specific protocol that we go through. You can use internal family systems with that. You can use ego state psychology work with that. You could just use cognitive work with that. But you're really using how the body is experiencing the trauma along with your thoughts, your feelings, and your beliefs. And then you can work at releasing them. And then we also use the music and the movement and all the various modalities that I also mentioned to you as well, to help the body process out and release the trauma that's stored in the body. Because the whole idea with trauma is you're trying to stay in the present moment. You're trying to be present for your life today. And when people talk about being triggered, they're talking about something happening that reminds them of who they were when they were powerless or unsafe, or whatever the negative belief is that caused the chronic or traumatic stress. And so they're being triggered into actually a way of thinking and behaving that is at a different developmental stage. And what we want to do is be able to repair that by using some of the modalities like EMDR and internal family systems and ego state work. And we want to get you present in your life today and be able to behave and act in the world and be in the world as your true adult self. So one of the most important parts, I think, from understanding that it's not mental health or physical health, but it is a mind-body health, is to be able to do a very thorough initial consultation that is a biopsychosocial consultation, where you're going literally from the time that the patient is in the womb of their mother and what was going on for the mother, because that affects the development of the child and affects the beliefs of a baby feeling safe or unsafe, or anything that happens in that birth history, that developmental history, can impact how somebody feels non-verbally. I often tell people you only have this little tiny part of your brain that is speech and language, and everything else is non-verbal. So we're not going to reach all our traumas just by talking. We really need to use the entire body and be connected to it and help people get connected to it and be able to repair and process that out and be able to get more present in who they are in their adult selves and their adult self strengths and beliefs. So I call it an integrative approach because we don't exclude conventional psychology, we don't exclude conventional medicine, because there's a time and a place for each thing. So if we understand that our bodies self-correct and self-heal, and that we have a system in our body called the endocannabinoid system, which is the system that modulates every other system in your body, your cardiovascular system, your neurological system, your central nervous system, your endocrine system, like every system in your body is regulated and modulated by the endocannabinoid system. That is a plant-based system. That means our bodies make cannabinoids like CBD and THC and the other 140 some odd cannabinoids that are out there, but also plants work on that same system. So cinnamon, citrus, clove, all of those also work through the endocannabinoid system. So there's so much momentum we can make by using plant medicine that can help to support in regulating the central nervous system, like we see with different types of cannabis products that can regulate seizures. That's been well studied. But we can use different plants that can also support our systems in being able to be more modulated and regulated back into that homeostasis state where the body self-corrects and self-heals. Now, there are times where a body has been under so much stress for such a long time that you could have severe OCD from the avoidance of whatever the pain is from earlier on in life. And sometimes you just can't get people to stay focused enough past those negative beliefs that are just cycling and cycling, in which case pharmaceutical medicines may be necessary. Just to be able to quiet that mind down enough so you can get in there and do the work. And I tell people, like, give yourself 6 months on a medicine and really get into the work. And when you do the work at 6 months, we can then consult with our team. And that therapeutic alliance between the patient, the doctor, and the therapist is so important for that sense of safety and trust and being able to build treatment plans that are most effective and efficient for that patient. So being able to sit there and say, let's do this medicine for 6 months and see how we do, and what kind of momentum we got from the work that we're doing, from your nutrition, your exercise, your meditation, your mindfulness, doing the actual trauma work in therapy, and how much momentum did we get, and can we start decreasing the medications and use more of a nutrition and plant-based way of managing the body. And sometimes you can do that very successfully, and sometimes there are people who just aren't willing to do the work, or who have done the work and their body is in a place and it's going to take a longer period of time, so you stay on the medicine longer. The whole idea is that you're in the process and you're getting healthier and healthier as you go down the path. There are cannabinoids called CBDA and THCA. That is the raw form of the cannabis plant. And so it never gets heated up to where it becomes intoxicating, and it never gets heated up to be CBD and THC. So the easiest way to say it is like raw broccoli has certain nutrients and cooked broccoli has different nutrients. It's not that one is better than the other, it's you need different ones at different times. So just because you had raw broccoli with lunch in your salad doesn't mean you shouldn't have cooked broccoli at night with your dinner. You're gonna get good nutrients from each. So when you have a formula with CBDA and THCA in it, doesn't mean you don't want to have any THC and CBD. It's that, what's the purpose? Like, you need to know what you're trying to accomplish. So we have our patients take formulas that are CBDA and THCA, and we put 5 other plants in it that have properties that enhance what that CBDA and THCA can do. And that, to me, seems to, and I said seems to because it's only been studied, like CBDA has been studied, THCA has been studied. So when you put them together, it seems to regulate people's bodies well enough that if they have an underlying level of anxiety, this seems to be able to support it really nicely. When patients can have cannabis, I created a formula called Mood Boost, which was studied by the University of Miami for calming the body and elevating the mood and fighting fatigue, and it has so many benefits, as do most plants, right? Because they're out there in the weather, and they have to be antiviral, antibacterial, some are anti-tumoral. So plants are very versatile and can work on your body in many ways. This formula we use for anxiety. So when patients can't take any cannabis plants because they're in an illegal state for cannabis, or they're traveling overseas, a lot of people will take the mood boost with them, which is cinnamon and citrus and clove, and that seems to help them keep their body calm but still elevate their mood. There's no intoxication. Those are all FDA approved, safe for food consumption plants. So we will offer them that. There's also other levels of cannabis plants that we use as well. So if people have more anxiety past needing their body to be regulated, sometimes CBD can be very helpful. A lot of times CBD with a little THC is really a great way to go. And oftentimes we'll add extra plants to that too, depending on why that person has that anxiety. Are there other medical health conditions? Does somebody have seizures? Like, it just depends on what else they have that we would determine based on their body, like what would be the best plants for them. And then there's another tincture that we also use, which is a half CBD, half THC tincture, for when there's a lot of anxiety and you're at home and you don't have to worry about intoxication. And so that can make you feel, even in a microdose, like very calm. And so some people can't take that to go to work or to leave the house or what have you. So that can be used as well for different levels of anxiety. Another plant formula that we use in our office is a formula that I created called Recovery Boost, and it was built on several plants that work on decreasing inflammation, and they're known as analgesics, which are plants that can decrease pain sensation. So all plants support the body in going back into homeostasis, right? So we want it there so that we can get it to self-correct and self-heal. So when there's tissue damage in your body and you get to use certain plants that can help heal tissue damage, it's trying to get your body back into homeostasis and can target, the areas that are out of balance and help that get back, a more focused way of getting back into homeostasis. In addition to integrative mental health, and in addition to plant medicine that we do at our center in Boca Raton, I work with Dr. Michelle Weiner, and we do ketamine-assisted therapy, and we have a really amazing team of nurses and experts in the field of integration, like breath work and meditation and mindfulness practices and lifestyle coaching. And the way that we do our ketamine is a very brief treatment, focused model, goal-oriented, to try to help people come in to accomplish what they want to accomplish, whether it is to stop using drugs and alcohol, or to help them get out of PTSD or severe depression. We make sure that we have very full, like I said, that full assessment that we do, that full biopsychosocial assessment, and then we really focus it down with them. And then we are there, the entire therapeutic alliance between the nurse, the doctor, myself, and the patient. We're all there for that person so that they feel a sense of safety and connectedness, so that when they're having their experience, not only are they focused and know what they want to go in there and get out of it, but that they feel that sense of truly being taken care of, that they can let go and be able to be present for themselves in their mind. And when they come out of it, we're there to support them as they exit their treatment. And then we do integration sessions where not only do we talk about what happened in the experience and how to bring it into their daily lives, but there's a lot of neuroplasticity that comes with ketamine that we can capitalize on. So you can actually prune the negative beliefs even more easily when you have that ketamine still present for them, and you can install in new positive beliefs and behaviors while they still have that neuroplasticity. So it's a very exciting way to practice. And I think as more and more psychedelic medicines become legal, I think there's going to be a wonderful way of being able to use ketamine and MDMA and psilocybin mushrooms and some of the other modalities of psychedelics, because different ones work on different systems in the body. So if you look at ketamine or MDMA, you're looking at oxytocin and dopamine, which is so important in mental health. When you're looking at psilocybin, you're looking at the receptors in the body, the psilocybin receptor, the serotonin receptors and serotonin production. And so when you're looking at cannabis, it modulates the system. So if you can affect change biochemically with ketamine and MDMA and psilocybin and other psychedelics, and then you can use cannabis to modulate the system, like we have a way of really affecting change in the body from a biochemical perspective at the same time that you're working on all of the psychological and body traumas and releasing them. That can promote some really good healing and allow people to go on with their lives in a more successful and peaceful, happier way. Ketamine treatments vary depending on who the person is, right? So if we're doing psychedelic dosing of ketamine, it could be 1 session, it could be 3 sessions, it could be 6 sessions. We usually take a break after 6 sessions if somebody needs 6 sessions, because you just want to capitalize on that momentum, or you might just be done. Sometimes people have 1 session and we got what we needed and they just want to finish doing the therapy work. Or they've done the therapy work and the 1 session was the way to pull it together, and you just have to integrate that. And we've already had their life plan, their time management, the skills and tools that they're using, how they're moving forward in their life. We've already done that work. So it depends on how someone comes to the table for their ketamine. It's very personalized. It really is, and how someone responds. We have patients who come to us for ketamine, and after we meet with them, we say, you know what, we don't think you're ready to do a psychedelic dose. Why don't we microdose? Let's do some of the therapy work, get some momentum, and then we'll walk into a psychedelic dose of, we call it psychoanalytic dosing of ketamine. I'm Shari Kaplan. I have practiced integrative mental health for over 30 years, and I have been making plant medicine formulations since 2004. And if you're interested in doing any work or being trained as an integrative mental health clinician, or you would like to have some integrative mental health treatment along with ketamine-assisted therapy, we're available at Connected Wellness in Boca Raton, Florida. And we also work with Dr. Michelle Weiner in Boca Raton and also in Miami. So we have offices in Miami where we can help you as well. And Shari B's Potent Plant Medicine are some of the formulations that you can find both online on our website, which is connected.com. And we would be happy to help you out any way that we can.